Good evening and welcome to another installment of Democracy 30 here on SABC News Channel 404. My name is Oliver Dixon. Thank you so much for joining us. Remember, you can stream and watch us live on the SABC YouTube channel. Just go over to SABC News on YouTube and you can see the product and the broadcast live over there. The question we ask tonight is, what makes a healthy society a healthy society? In 1994, the new democratic government inherited a generally unhealthy population and an unequal health system. Added to this was a society emerging from a violent past with deep trauma and psychological scars. The lingering trauma is felt in today's violent society, the roots of which are yet to be addressed. Tonight we ask, is South Africa a healthier nation 30 years after democracy? To discuss, we are joined by Dr Themba Moeti, who is the Health Systems Trust Director, and Ndivhuwo Rambau from the Ritshidze project, whose main focus is on monitoring the primary healthcare system. But first, let's take a look at this insert for some context.
The apartheid healthcare system was divided and skewed overwhelmingly in favor of a white privileged minority. In 1981, for example, according to the Health Sciences Research Council, there was one physician for every 330 whites compared to one physician for every 91,000 black South Africans. Infant mortality was 20% among the black population compared to nearly 3% among whites. The 1994 National Health Plan provided an integrated, equitable and comprehensive health system based on a preventative primary health care strategy. This included the integration of 14 previously separate departments, including of previous Bantustans, into National Health System, as well as the removal of all public health fees for pregnant women and children under the age of 6 years. But the new healthcare system was established just after the onset of the AIDS epidemic and was forced to cope simultaneously with residual, chronic and often poverty-related health conditions such as tuberculosis.
I'm committed to ensuring that the department is led by people who represent all the people of our country. At the moment, 99.9% of the management echelon are occupied by whites and mostly males. Africans, coloreds and Indians have to share the remaining 0.1% of the management posts. This is unacceptable.
The healthcare system has gone through challenges over the past 3 decades as it dealt with the consequences of, among others, the so-called AIDS denialism between 1998 and 2009, maladministration, substandard service delivery, understaffing and overburdened facilities. But the country has also enjoyed significant successes with a positive trajectory on life expectancy and child mortality figures. Following a 2009 court order, South Africa now offers free HIV and AIDS medication to citizens, and it has enforced stricter smoking laws and legalized abortion. But there is much to heal, as the persisting two-tier health system continues to offer superior services in the private sector compared to its public counterparts. Contestation remains whether the recently passed national health insurance legislation will enable further access.
And that was their package, giving us a context to what this conversation ultimately is about. Is South Africa a healthier nation today? We'd love to hear from you, so do find us on X as well. You can simply tweet us at SABC News, or you can tweet me. It is at Oliver_speaking over there. Like I said, I'm joined by Dr Themba Moeti of the Health Systems Trust, as well as Ndivhuwo Rambau of the Ritshidze project. I'm going to start with you, Dr Moeti. 30 years is a relatively short period in a democracy to measure the health improvement of a generation within a lifetime. But would you say South Africans are generally healthier today than they were 30 years ago?
Okay. Right, thank you. And well, first, I guess you have to look at the fact that to ask what was happening in the health service 30 years ago compared to today. 30 years ago was 1994. That was really the early period of the HIV epidemic as it started off in the country. So 30 years ago, you'd have had relatively fewer people living with HIV than today. But if you look at access to healthcare in the country in terms of the different population groups, as you'd be aware, 30 years ago, basically the democratic South Africa inherited a system where you had a very fragmented health service, a health service that focused really on the, in line with apartheid policy at the time, privileged members of society. And of course, there were race disparities in the different race categories, whites, Indians, coloreds, and Africans. And of course, the majority of population being African people had the least investment in their healthcare, in schooling, and all those other issues. And those play an important role in terms of what the health of a nation is like. The difference between those services was night and day, really. So if you look at access to healthcare today in terms of people being able to largely access it without payment of fee for service, generally, significant fees, that is. Children under 5 get free access to treatment and preventive services. And if you look at the last few years, we've had a reduction in infant mortality rates, neonatal mortality rates, and under 5 mortality rates. But in the period prior to that, as some of the commentary...
How important are those indices? We'll take a look at them later on in the show. But how important are those indices as a measurement of the health of the nation?
Well, generally, some people would say, even from a non-health perspective, that if you want to assess what a nation's health is like, you also need to look at the health of its children. Okay, and so if you look at those indices in terms of access to care and giving people the potential to live a better and healthy life, they are very important indices overall. But I think the context I wanted to give in talking about those indices is that, so we've spoken about access to care, okay? We've spoken about also, if you look at the challenges that the country is facing, around 1993-94, that is really, as I mentioned earlier, when the HIV pandemic was really beginning to set foot in the country. And of course, it had devastating impact over the next decade or so. And of course, and the country's dealing with that problem was delayed by the AIDS denialism period that the preview alluded to. Yeah. So during that time, a lot of time was lost. Many people who died, whose lives, the cost of that period is estimated to have cost about 330,000 lives that could have been saved. And that 330,000 lives that could have been saved means many children who were orphaned would not have been orphaned, and so forth. And the dependency ratios in society then become much greater. So for me, overall, I would say that, well, there are big challenges still that the health system faces as we go forward. But overall, if you look at access to health care, especially for the underprivileged groups in our country and in society, I would say that on the whole, I think people do have better prospects if you look at the whole of society.
I want us to focus on that for a minute. You have access to a high density of data when it comes to healthcare facilities. And so when we stick to access to healthcare, having access to a clinic or a hospital or any other community and primary healthcare facility is one thing. But what is the quality of that access like once you reach that facility? And what are some of the challenges that still linger 30 years on in South Africa when it comes to access to those facilities?
Thank you, Oliver. So when we look at South Africa, we have over 46 million people who access healthcare services at public healthcare facilities. And we understand and we note that government has made its stride. Well, the current government has made strides in improving healthcare, but when we look at the Constitution and where in Section 27 it says that we have the right to quality healthcare services, we are still holding government accountable to improve those services. When we look at our facilities, our clinics, most of those infrastructure was built in the apartheid era, and those buildings have not been maintained. And when we look at the World Health Organization standards, they note that a catchment area should serve between 10 to 12,000 people. If we look at the burden that is on healthcare facilities at the moment, that has now tripled. And with in-migration, with urbanization, with people moving around, we find more and more people accessing health facilities in different areas. Populations have grown. This then leads to the overburdening of the healthcare system, where nurses, healthcare facility workers are just overburdened. They are tired. There's so much to do, and the resources are not there. Our clinics, our facilities are not as resourced.
Have we, as a percentage of population growth and as a percentage in proportionality to healthcare service demands, have we built more hospital clinics and produced more doctors and nurses over the last 30 years that can meet that level of growth?
You know, when we look at our Ritshidze data and the current monitoring cycle, we had over 80% of facility managers who indicated that they do not have enough staff. And when we look at the cadres that are, you know, in high demand, it's professional nurses. Over 77% of facility managers say that they do not have enough professional nurses within the facilities. So that tells us that the system in itself is broken. It needs to be fixed. We have so many cases of medical negligence because the healthcare workers are also tired. And then from that same pot, when people go and report for medical negligence, it comes from the same budget. It's not like there's another budget where monies need to come from. And that money should be going into producing more doctors, creating more clinics and so on. So we do have a serious challenge. That
in fact,
really
in the last
need to
financial
fix.
year, we spent, what, 1.7 billion rand just on medical negligence claims. We're going to come back and look at some of those other indices that indicate the quality of life, at least for, as far as healthcare is concerned in South Africa. We'd like to hear from you. Let us know what some of your thoughts are on this conversation as it unfolds. It is simply hashtag Democracy30 at SABC News. Don't go away. We continue the conversation on the other side of this break. Conversation with Dr. Themba Moeti from the Health System Trust and Ndivhuwo Rambau from the Ritshidze Project. We're asking the question today, is South Africa a healthier nation 30 years on into democracy? Let's take a look at some of the indices and the numbers that describe, not exhaustively, but to a useful extent, the state of South Africa's healthcare over the last 30 years. If you take a look at the numbers that will come up on your screen at the moment, right behind me over here, healthcare life expectancy in South Africa in 1995 was at around 61 years, 61 and a half years. And as the AIDS pandemic settled in South Africa, life expectancy sharply dropped to about 53.9, dropping by nearly 8 years. And over the years, especially after 2008, you can see a sharp increase in life expectancy from around 2010, that reaching 57.2, and back into the 60-year mark around 2015, and in 2023, despite COVID, sitting around 64.8 years, which exceeds the 1994 and 1995 baseline point where we started at. But if you look at this next set of data and information on the next slide around infant mortality, very specifically in South Africa, you will notice that there's a very similar pattern in how the data spreads itself out. Infant mortality in 1995 sitting at around 43 babies dying per 1,000 births. And that number sharply increased to the peak around just before 2005, with 51 babies per birth dying, per 1,000 births dying over there. And that number sharply came down to around 23 and a half births per 1,000 23 and a half deaths per 1,000 births, my apologies, in 2003. A very, very sharp decrease, performing much, much better than those baseline numbers in 1995 and 1994. Dr. Moeti, I perhaps want to ask you this in reflecting on these numbers. Is there a corollary relationship and a concomitant relationship between life expectancy and the health of a nation?
Well, I think there is. And, life expectancy, what we like, to talk about life expectancy figures is one thing, but we also want to talk about healthy life expectancy, so that in the end an individual is healthy, but during that time. But certainly if you look at these figures on these two graphs that you just showed, they indicate very sharply what the impact most likely of the HIV pandemic, and then how the system was then able to deal with it. But so for me, that is a very important index. And if you look at developed countries which have mature health systems and other systems in place, you'll find that their life expectancy figures are significantly higher than ours. But what these figures do show, and as Ndivhuwo was indicating, our health system has many, many challenges in terms of the burden of what it needs to address. Yeah. But what was, I think, particularly important is once a national HIV treatment program got put in place, we saw how there was a significant and very dramatic change in life expectancy. And over the period of about a decade, it increased.
Let's get into the minutiae
10%.
Of that. Ndivhuwo, what was key interventions in the National Health HIV and AIDS Health Intervention Program, especially around 2008, where we started seeing those numbers sharply turn around, not just from a health perspective, but also from a social welfare intervention perspective? How did those two things come together to meet each other and create a more resiliently healthy nation?
Okay, so also moving on from when we move from AIDS denialism and also getting people on treatment, specifically for HIV, that is an improving factor, but also educating people and trying to remove the stigma around HIV and getting people to test and be initiated on treatment almost immediately after testing. So those are one of the key factors that have actually helped in improving things like psychosocial support. We can't say that you are healthy without having mental health as well. Similarly, you can't be saying that I be taking all of this treatment, whether it be HIV treatment, diabetes, TB treatment, on an empty stomach. So all of these factors all needed to come in together with your grants and everything to help people to become healthy, to be able to access your health and be able to also live with dignity.
Is the quality of healthcare that we give people in South Africa comparable to the rest of the world? That is to say, do we have doctors, nurses, lawyers, and medical science facilities that give good quality healthcare in Ndivhuwo?
I will start on the side of key populations. When I say key populations, I'm talking about transgender people, sex workers, people who use drugs, gay, bisexual, and other men who have sex with men, as well as the LGBTI community. When you look at the Constitution and it's saying we should have access to health, that is not the case usually for most key populations in the LGBTI community. In most instances, we've had reports of over 80% of people who use drugs who say that I've stopped using the clinic because of how I'm treated. I'm not treated well at the facility. I'm not welcomed at the facility by healthcare professionals. So we will not say that it is of quality. We have transgender people who are struggling to access hormone therapy as well as gender-affirming services in the facilities where there's no gender neutral toilets, for example, for a person to use when you go to the facility. We have so many people who are initiated on on treatment, who end up leaving that treatment because you get to the facility, you wake up at 3 a.m. in the morning. For you to be able to start queuing at the facility at 5 a.m., by the time you get inside the facility, they cannot find your file because the filing system is a mess, because there's not enough infrastructure or space to put your file away properly. So there are a lot of challenges that still need to be addressed within the public healthcare system as well.
We're going to pick it up from there in a very, very short while. Coming out of apartheid, obviously an incredibly violent experience for South Africans. Psychosocial trauma had contributed and deteriorated the population's mental health in significant ways. We're going to ask the question, in what ways does that reflect in the health of our nation on the other side of the break? Don't go away. Back to Democracy 30. We took to the streets to ask South Africans about their views on the country's healthcare system. Let's have a look at what some of you had to say.
The private health system in South Africa is much improved, but in terms of the public health system, I feel like they're still lacking that. I think they can do better.
I personally think our health system needs urgent attention, because if you walk into any public facility, the service is not good. As a young generation, we're now being impacted to go more into medical aid and those sort of things. When we are paying our taxes monthly, when we have the infrastructure for it, it's just not being taken care of.
I would say it's not as good as I expected it.
In my view, I feel like it has collapsed. I try going the public route, but the lines at the clinics, the lines at the hospital, we are forced, even with the little money that you have, to get medical aid, because with medical aid you get better health care.
I think the health system has really collapsed, and it has gone down because the service is not up to standard. People get to stand in long queues, and sometimes you find that there are no medicines.
From where I come from, I don't think it's much of a huge problem.
Those are some of the views that came up in the streets of South Africa. Dr. Moeti, just how unequal is South Africa's healthcare system when it comes to an access to health and when it comes to the quality of that health, especially given the views that some of the South Africans shared in that insert?
Yes, I think those views are very real. Ours is a very unequal health system. If you look at it, you can get excellent care in the private sector, but at a huge premium, and at the kind of rates and charges that you would have for developed countries, really. You know, I mean, the costs in the private sector are very comparable to that. Now, if you look at the bulk and about 86% of the country's population that are treated in the public sector, but I think only about 12 close to around 60% of the health budget, the total, is spent on those. And for the remaining 60%, it's about 40% of the health budget. A very different, very different systems. And I think we've got a fairly good HIV program, huge challenges, as Ndivhuwo has indicated, especially when it comes to key populations and vulnerable groups that it needs to address better. But if you look at the way many of our health facilities function, yes, indeed, I think what was being described is a very real experience that people have.
But perhaps I want to ask you this, Ndivhuwo. What are some of the remnants of the apartheid unjust healthcare system that still linger in democratic South Africa today in 30 seconds?
So I would say just looking at the distance that people in rural areas have to travel in order to get healthcare services. There are people who still have to wake up extremely early, book a little bakkie to get to the clinic, which still tells you just that there's a really big disparity in being able to access your healthcare services when you are living in a rural area, and even being referred to a hospital. One hospital in a rural area might not even have something like kidney dialysis, for example, and you need to be transported 2 hours away in order for you to be able to get that treatment. So there is really a long way to go in for us to say that everyone is getting equal and quality healthcare in the country.
Yeah. We're a deeply traumatic population, Dr. Moeti. Are we doing enough in primary healthcare and in public healthcare to deal with mental health as part of our overall healthcare crisis?
I think mental health and mental health care services, I think, are amongst those where really, even with the challenges in the health system, that really there is underinvestment. There are access to quality mental health services is relatively difficult. I think if you look at good mental health services should be ones in which you will have a strong base for the kinds of treatment that can be offered at the community level, in primary healthcare facilities and others. And it is at that level that those services really have, in many respects, are very rudimentary and fairly limited. And it's when you go to the larger health facilities, your big hospitals, you get specialist services. So it means then that quite likely access to services for people with mental health challenges is far below what it should be. And those are some of the indications then of the kind of work that we need to do to transform that reality and strengthen really what are the primary care level services.
So I have a long way to go before we get it all right. But of course, it is a complex machine to run a healthcare system. But that's it for today. We're going to have to leave it there. Thank you so much for watching. And we hope that you have a wonderful evening and a happy Mother's Day to all the mothers out there watching the show. We're back with you next week at 8:30. Good night.
SABC News.